Thank you so much, Jenny Loganius. I'd like to end with a couple of final questions. Walter Ricciardi, because he has to leave us, part of the things I said have to do with your sector. Walter, you spoke about the 8th wave of the pandemic and the winter at our doors is less risky for vaccinated people, and it's an invitation to get vaccinated again. And you mentioned hospital infections and antibiotic resistance as the two big problems. I'd like to ask you something. The government is being formed right these days, and you were councillor for the latest health minister, scientific advisor. If we have another complex winter for the pandemic, what will be done? I believe everybody knows it. Yes, resources were allocated in the worst period of the pandemic. But today, if you think about public health, and especially public health of the future, you have so many question marks, right, Walter? We have to avoid making science political. You defeat pandemics if you apply scientific knowledge, and scientific knowledge is global. Since the beginning of the pandemic, starting from the period when Italy was the first country to be hit in China, we've been exchanging information with government representatives. Then it's difficult to implement things. We couldn't achieve it all. And in the Council of Ministers, other voices and opinions were expressed. In Italy, the compromise was always upwards, never downwards. Other countries raised the bar. I'd like to give you a figure. In the latest flu pandemic, 1918-1919, there were 100 million deaths, and in the States, 675,000. With the present pandemic, 15 million deaths, 1.5 million in the USA. And there was a highly political debate, and masks were Democratic, non-masks, Republicans, and so the deaths amongst Republicans were higher. When you make a choice just like Bolsonaro and you cause 650,000 deaths just in Brazil. What happens in those countries? Every reaction from the civil society. And the challenge is that adequate choices should be made by government. Government should make a vaccination campaign. If the vaccine is available, well, it's not enough because people say, why should I get a vaccination? And no information was given about vaccinations, and vaccinations protect against severe disease and death. The best vaccination is vaccination you get as early as possible. There are so many elderly people that unfortunately will get ill. The virus is objective and it's not something subjective. And the present virus, to make you understand the difference, it has the same pathogenicity, but its virulence that is 19 times higher than the flu. And if you go to a closed environment without the mask, you get it. The hope for each one of us is that the government may act, otherwise protection is individual. And what I do in the organizations I work, when I meet people I know, I ask them to wear the mask when they catch a train, a bus. And if you get ill, immediately enter in touch with a good physician. And we have antiviral drugs that can be prescribed, and many physicians don't prescribe them. If you are a patient of that physician that doesn't prescribe antiviral drugs, you run a higher risk, and such things should be done by the government. And for the themes debated tonight, I'd like to ask you something. You're also a member of Istituto Superiore di Sanità in France, higher health institute in France. And the French, compared to us, was appointed by President Macron. This government listens to the opinion of science, even if it mediates the choice to include French scientists originated from the fact that in the first phase, French scientists that were saying same things we say, they were not listened to. And so they decided to invite foreign scientists, and the French said the same things, but they were not listened to in the first phase. France. What catches my attention is that France acts all over the national territory. Instead, here we have regions, various regions. It's an old issue. Luigi Sbarra. I have a question for Luigi on current themes, and you as Chisler launched the alarm 1 million jobs at risk for the energy crisis and this difficult economic situation, and obviously now ministers are being chosen, but considering what the new Labour minister will have to do, the theme of occupational safety or safety at work, would it have a priority or not? We hope that the new Labour minister may be available for dialogue and exchange with social partners, and we have open dossiers and just through the availability to have an exchange, it's possible together to help the country raise from the ashes of the health emergency. And I agree, we shouldn't lower the bar, and we should have at work respect and compliance with what we decided in 2021, that is to say, the use of a mask, distancing, and sanitizing of places, and careful respect of rules. And I keep on believing that vaccination is our safety, and we should convince those that have doubts to get vaccinated, and then also booster vaccination. I believe it's necessary. It's an integral part of the commitment that we'll have in the field of health and safety. We will speak with the new minister, and we'll submit again the content of our platform that the government knows so well.
Costruire insieme.
So, first aspect, creating with the new government, in the case of the emergency of death at work, creating a national strategy based on lines of action and qualitative, legislative quality, coordination and sharing of data banks, and also resources necessary for the purpose of investments. Without resources, and I'm sorry that the minister Damiano went away, but just like he said, he's a member of the board of INAIL, and it's the Italian Workers' Compensation Authorities, and INAIL has resources given by enterprises in the field of safety and prevention at work. And I will ask the new minister if we have to wait further. Each year in December, INAIL closes its budget with a big surplus, almost 1.5 billion. It's a surplus, and we know that each year, on December 31st, a coupon, 1 billion toward the Ministry of the Economy, and such resources are necessary for the state budget and reduce public debt. It's no longer acceptable. Those resources must stay in INAIL because on the one hand we have to increase profits and expand the perimeter of performance, and then help those companies that want to invest in safety and health at work. We need to carry out research, and those resources must be redistributed and reused to the benefit of workers and enterprises. It's a very important theme, and together we can win this battle, and we have to really stop this silent disaster, this stream of blood, through the commitment of everybody, and it means getting to agreed upon choices. Second theme, and just one additional minute, Andrea, will ask the Labour Minister to put at the center the labour issue, and labour should be relaunched in this country in qualitative and quantitative terms, and labour should be connected to the freeing up of public and private investments, and we shouldn't think that we create work through subsidies. Yes, subsidies are essential to fight against poverty, but work is not created through a decree or ink in the official journal. Well paid for jobs, highly qualified jobs are possible if you have public-private investments, and we should think along such lines. Work, relaunch of investments, and then investments in training. And there's a contradiction. It's a typical Italian contradiction of having high rates of unemployment, especially youth and female unemployment, and companies that need professionalism and don't find it, and availability of knowledge, and we have to govern this non-alignment between supply and demand. It means investing in working policies, and public employment offices should establish coordination with private entities, and we must invest in vocational training courses whereby people can be integrated in the labor market, and in the future knowing will be more important than having so labor training and working policies, and we have this extraordinary opportunity of the National Resilience Plan. For the next 5 years we have 4.5 billions in terms of resources for enhancing competencies and labor policies. Something else. Always remember that working age is a risk factor, and you cannot ask somebody who is over 60 years of age to climb up a ladder 30 meters or scaffolding. We have to also consider the theme of pensions with the new government, whereby the Italian social security system can be fully inclusive, fully sustainable, and we have to speak about contributive pension for the youth and women, and we should invite people to adhere to complementary pensions, and we should introduce the theme of risky jobs and flexibility windows to get out of the labor market, to have a turnover of labor force. So the dossier that will be in front of the new labor minister will be an important dossier, and everything is made more difficult by energy price increases and increase in the price of food and inflation that is at 10% in the case of the shopping cart, and the risk of recession at the end of the year. We have to fight against closing of companies and decrease in the income of families. And amongst the most urgent items to be tackled by the government before a stability law, we should have a new decree that gives help to families and enterprises, considering the increase in prices of bills. And the leader of Fratelli d'Italia, Meloni, sets the emphasis on social dialogue, and she reassures about a continuous dialogue with social partners to build together solutions for the common good and general interest of the country. And as usual, Chisler will judge the tree from the fruits of the tree. Thank you so much. If there's nothing to add, I'd like to end here. I'd like to extend my thanks to Lorraine. Thank you so much, Jenny, and Professor Walter Ricciardi, and Luigi Sbarra, and all the others. We'll meet you tomorrow morning. The theme of memory mentioned so often today, and at 10:30 tomorrow. Thank you so much for your attention, and enjoy the rest of the evening. Goodbye.